Holy Name Medical Center is proud of its affiliation with the New Jersey Center for Prostate Cancer and Urology. This center provides a wide scope of surgical services through robotics. The 6 surgeons treat patients for many forms of cancer, including cancers of the prostate, bladder, and kidney. Dr. Vincent Lantieri, the senior partner, started his private practice back in the early 1980s. At the turn of the millennium, exciting things were happening in the field and in the practice for Dr. Lantieri and Dr. Michael Esposito.
In 2000 and 2001, Dr. Esposito was doing a fellowship in Edinburgh, Scotland on urologic laparoscopic procedures. With that and the fact that we went to Paris and learned the laparoscopic prostatectomy, we then came and started doing that surgery at the same time that the robotics was being developed. We incorporated the laparoscopic into the robotics and began doing the robotic laparoscopic radical prostatectomy.
Drs. Lantieri and Esposito, along with colleagues, authored a renowned book entitled Urologic Robotic Surgery.
What we do intraoperatively for an hour and a half, that patient lives with for the next 20 or 30 years. So there are parts of the operation that we are very, very meticulous with. We've done it so many times that we've tried all the different techniques, so we tailor the actual components of the surgery to each patient's different anatomy. And the outcomes are much different than they used to be. With all of that attention to detail, we can preserve continence. The same applies for a man's ability with potency.
The New Jersey Center for Prostate Cancer and Urology is not just about men's health concerns.
So as much as prostate cancer is a big deal, it's a very common cancer and it affects men only, all the other cancers that we deal with also have an equal predilection to women. For example, kidney cancer, bladder cancer, urethral cancers. All of those cancers have an equal predilection for women. But not only cancers that we deal with, things such as stricture disease, stone disease, stones, probably more common than even cancer, have an equal predilection for men as well as women. So as much as prostate cancer deals with men, all the other issues that we deal with, including benign disease, have female patients as well.
For patients with bladder cancer, Dr. Mutahar Ahmed explains that the grade of the cancer is key. As a result, there are many treatment options.
We basically not only do the state-of-art surgery when you need it, when you need your bladder to be removed, also provide the basic. So when you have a low grade, provide the state-of-art in that sense where the bladder doesn't have to be removed. And also we work with oncologists. So sometimes if you don't want your bladder to be removed, there are other things we could do depending on your cancer stage and your cancer type that we may be able to even spare your bladder.
Dr. Gregory Lavallo explains the advances in kidney cancer surgery.
In kidney cancer, we used to treat all these tumors by removing the whole kidney. And over time, we realized that removing just the tumor itself was enough to cure the cancer. So it began with smaller tumors, big open operations between the ribs, big painful incision, and we would remove just the tumor and reconstruct the kidney. And now with the advent of laparoscopy and more importantly robotics, we're able to remove tumors, reconstruct the kidney, all through very small incisions, the size of a keyhole. And particularly with the experience that we've gotten, we're able to do larger tumors now. So we're doing tumors that are 4, 5, 6 centimeters in size, which is the size of a tennis ball, and still able to reconstruct and spare normal kidney to preserve function for somebody so that they don't have to worry about dialysis and things like that down the road.
This practice thrives because of the expertise of the surgeons and their approach to teamwork.
I met them when I was as a resident, and I saw how they worked together, and really at that point I realized that this would be a great practice to join because they really all support each other. We do a lot of big cases in this practice, and a lot of times it requires several sets of hands, and it's really nice when you know that you have multiple people you can rely on and get along together. And that's definitely what you find in this practice.
For more information, go to www.roboticurology.com.